Heartworm medication is a prescription product, unlike flea controls, which are considered OTC. So even at home, your flower pots that you have, empty flower pots that you have outside, is retaining water in the backyard. So then it attracts mosquitoes. And if your pet gets bitten by the wrong mosquito while it's feeding blood, it's going to inject worms into the bloodstream that go to the dog's heart. So this is a dog's heart, and those squiggly things there are worms. Humans can get heartworm disease. It's seen as a nodule on x-rays in the lungs, but it does not seem to cause a problem in humans. In dogs, heartworm disease causes a cardiac or heart problem. In cats, it causes a respiratory or allergic problem. So cats are allergic to the presence of the worm. They almost act like they have asthma. Dogs, on the other hand, because of the hundreds of worms that they have in the heart itself, cannot oxygenate and pump blood effectively because you have worms where blood should be. So over time, it causes a lot of debilitation. They lose weight. They look unthrifty, they're very lethargic, they're coughing, they're tired. When I first started practicing 20-something years ago, that's how those pets looked. Today, they look robust, fat, healthy, walking around happy. You would never know to look at that pet. So the way we diagnose that is to take a blood sample, a couple drops of blood, and we can run an in-house test to see if they're positive for heartworms. We had a dog yesterday, bull terrier, and she came in from a rescue group. And I said, "Has this dog been on heartworm preventative?" No, which I was expecting because it was a rescue. I said, and she came in to be spayed. I said, "Let me do a heartworm test," and she came up positive. Then we put a drop of blood on a slide and looked at it under the microscope, and you could see the little baby worms just moving around under a microscope, microfilaria. Very common in the South. They say that about 80% of dogs in Louisiana are heartworm positive. Why? They got a lot of swamp, right? They got a lot of water, got a lot of mosquitoes. There is heartworm pretty much in every state. It's just a matter of where it's endemic and where you have these high areas. Much like you have Lyme disease in the Northeast and Connecticut, Pennsylvania, those states. We don't have much of it here, although it's coming down the East Coast because people are moving, right? So where pets go, those diseases follow. But there are different formulas for heartworm medication. You can have an injection that lasts for 6 months. You have to give that to pets over 6 months of age. We have topicals that are a combination of heartworm and flea, typically, that also come as an oral pill or as a topical application on the skin. All of those are given monthly. Typically, most practices will sell it as a 6-month supply or a 12-month supply. We typically will do a heartworm test, make sure that pet is negative, put them on a heartworm preventative. A year later, they come back in. Typically, it's done with their annual vaccines. We retest them to make sure that the product was effective, because people forget. They may give it late 1 month, they may forget a month. You know, you do have the possibility for gaps. Nothing in life is 100% proof. So we retest them on an annual basis to make sure that they're still negative.